Yeah, greetings. You see, it is very easy for a pregnant woman to have hemorrhoids. You know what hemorrhoids is called? In our local parlance, it is called pie, right? During pregnancy, it is very easy to develop pie, especially as your pregnancy progresses. In the second trimester and in the third trimester, as the baby increases in size, the womb increases in size. This is because the pressure in your tummy increases. And because the pressure in your tummy increases, you are at risk of developing hemorrhoids. It's the same reason you notice that because of pregnancy, those of you that don't have any swelling around your navel before, you now notice that there's a protrusion, there's a swelling around your navel. It's the same mechanism that is responsible for swelling around your groin, around your pubic area, called the inguinal hernia, and the same mechanism that is responsible for swelling in your anus. That one is even, hemorrhoid is even not as severe as rectal prolapse. Do you know that some women can be pregnant and they have rectal prolapse? The whole anus, the whole rectum, part of the anus will push out of the anus. It will push out, right? So it's quite very common. Some women too will notice that they develop what is called a vaginal prolapse. Their vagina will push out of the opening during pregnancy. It happens, but I want to talk only about hemorrhoids in this video, right? And it's quite common, and some women get confused and they take all sorts of medications. But the truth is that all those medications you take are not really safe in pregnancy. What you need to do is to do what they call sitz bath, right? I'm going to put a video up here, right? A sitz bath. Lukewarm water, warm enough that you can use to wash your face. Not hot water, lukewarm, not very small. That is not warm, it's not hot, just warm. It's not even tea water, just warm. You put salt inside, you keep on turning the salt until you cannot see the salt anymore. Okay, until you can now see the salt inside the water, right? Then you sit on it. It's not the steam, or you sit on it. You let the water touch the pie. You let the water touch the hemorrhoids. It will help reduce that pain, the swelling, and the protrusion. It works, so, and that's the only remedy for the hemorrhoids you have. It's maybe after surgery, after you have delivered, after a pregnancy you have delivered, that you may now be required to do something definitive about it. So we have to require surgery to take out the hemorrhoids. Sitz bath is what it's called. You put a little warm water, you pour plenty salt inside the warm water. I'm not saying you pour the warm water inside a bowl. It's not inside a bucket, inside a bowl. Then you sit down inside the warm water. Don't go and burn your vagina and your buttocks. So the water must be warm. It's not hot, warm. There's a way they say it. Water that is warm enough that you can use to wash your face, and you will not be scared that it will burn your face. Just a little warm. Then you sit down on it and let the pie touch the water. It will wash it off, and you'll be doing it twice a day or 3 times a day, or for every time you go to toilet you do it, because hemorrhoids can be terrible. It can be painful, it can be strangulated, it can bleed, but you can take care of it. Just sit down on it, or use the sitz bath. It will help relieve the pain, reduce the swelling, and you will feel all right after it. I hope I've been able to pass a message. That's how you take care of it. For people that have been saying they have not said anything about hemorrhoids, I know I've said something about it before. I'm saying it again now. Yeah, thank you. Please don't forget to subscribe to my YouTube channel and my Facebook page. Thank you, and bye-bye.